Hello, welcome to any community. In this particular video, we are going to discuss the concept of diagnosing the disease in Ayurveda. That is, we are going to learn what will be the difficulties that one may face while making the diagnosis of a disease as per the Ayurveda fundamentals and how to overcome that particular problem. As far as disease is considered to be Roga as per the Ayurveda understanding. It is having the different synonyms based on the different parameters, that is Vyadhi or Amaya or Gada or Atanka or Yakshma, Jwara, Vikara, etc. These are the different synonyms. As far as diagnosing the disease of Ayurveda, in Ayurveda, we need to know what actually Roga refers to. The term Roga refers to Rogastu Dosha Vaishamyam. So that is the abnormal proportion of the bioenergy, what we can say dosha, that is being termed as Vaishamya. It is actually a relative term because the proportion of the dosha in one individual may be perfectly normal, but the same proportion in another individual that may produce serious consequences. That is why, so this particular abnormality in the dosha, that is considered to be a relative term. So here the term dosha refers to Vatadina. The Arunodatta commentary that says Vatadina. So that is the Vata, Pitta and Kapha, or otherwise Rajas and Tamas. If they are abnormal, maybe in terms of their decrease in quantity or in terms of increase in their quantity, either there may be a possibility of increase of any two bioenergy, either Vata Pitta or Pitta Kapha or Vata Kapha, or otherwise Trayanam Vrithihi. So that is the either Vata, Pitta and Kapha. Depending upon the nature of the Nidana Sevana, there may be a possibility of increase of any of these the dosha in excess as such, or otherwise abnormal decrease of any one dosha or two dosha or all the three dosha, they are being considered to be dosha, which is responsible for the ruja. So that is any kind of the discomfort. So here the term ruja, it is not referring to pain as such, could be the, what do you say, that the any kind of the discomfort. Excessive abdominal swelling, it is causing the discomfort to walk, etc., to wear the clothes, etc. It is a ruja. Or otherwise, the person who is suffering from the cough, etc., it's a kind of the ruja. Or breathlessness, presence of breathlessness, it is a ruja. Or the running nose, it is the ruja as such. So that is, in other words, Vaishamyam Vishamata Swarupat Chavaha. So that is, the Vishamata refers to the deviation from their normalcy. Suppose if the person is passing the bowels once in a day, suppose if he is not passing the bowels for almost 4 or 5 days, then it is considered to be Vishamata. Or otherwise, if the person is passing the bowels for more than 7 or 8 times a day, normally he usually passes once a day, then it is also considered to be a dosha vaishamya. So that is considered to be the term roga refers to. Whereas the Hemadri says dosha dushyam yadvaishamyam vikrutatvam tadrogaha. So that is the dosha, that is vata, pitta and kapha, or rajas and tamas dushyanam. So that is the saptadhatu or the malas. If they are going to have the abnormalcy, maybe in the form of increase in their quantity or maybe the decrease in their quantity, that is being termed as roga. So here the dosha shabdo antaranga hetu matra upalakshana. So here we have to consider antaranga hetuhu. It is not the bahya hetu. Vyayama is not considered to be the roga as such because Vyayama is a bahya hetu. abhyantara, they are considered to be, what do you say, that the dosha as such. If there is any the dosha or dusha affliction, that is being termed as roga. So rogam vatadina vishamata swarupati chalanam. So that is, what do you say, that as we have discussed earlier, so that is the abnormalcy or deviation from their normal quantity, either in the form of increased quantity or in the form of decreased quantity. Either there may be a possibility of increase of any 1, 2, 3 dosha as such, or the decrease of any 1, 2, 3 dosha, they are being considered to be roga. So here the meaning of the roga as such. So here we have to consider the roga meaning in a different way. So here the dosha vaishamyam. So there may be a possibility of increase of vata dosha abnormalcy, pitta dosha abnormalcy, or kapha dosha abnormalcy, that is being termed as roga. Further, if you analyze this in terms of the guna, if the ruksha guna increase in amashaya, that can be considered as roga, or otherwise nishwasa, that is what we can say, the inspiration, that is the air entry into the body. If there is any kind of the dysfunction, that is considered to be the vata dosha dysfunction, again that could be considered as roga. And in terms of the prakopa karma, for example, vyasa, sramsa vyasa vyadaswapa, etc., so that is what we can say, the dilatation of the part of the function, the body, that can be considered as abnormal functioning of vata dosha, that is considered to be roga. Or otherwise, if the person is taking little amount of the snigdha substances, there may be a possibility of increase of pitta or kapha dosha. That means the pitta dosha or kapha dosha, there may be a possibility of increase if the person is going to take the snigdha substances itself, that is considered to be roga itself. In terms of the manasika dosha, if there is any disturbance in the rajas and tamas, wherein the total the mental instability, or the that is what you can say, the rajas as such, and over mental stability or lethargy, where we are going to observe, that can be considered to be tamo dosha affliction. Further, when you think about the roga in terms of the karma, for example, the ruksha, that is being termed as yasya shoshane shaktihi sa ruksha. So that means if there is if you consider this as the alimentary canal, and if you are observing the shoshana karma that is happening from the alimentary canal to the intravascular compartment, so that means if that is going to get increased, so this is responsible for the increase of rukshata in the alimentary canal. Similarly, when there is increased shoshana karma which takes place from the intravascular compartment to the stomach, that is resulting in the increase in the shoshana karma of the in the intravascular compartment. So like that, in case of the shoshana karma from alimentary canal to the intravascular compartment, then we are going to say there may be a possibility of ruksha guna increase in the mahasrotas. Or otherwise, if there is an increase in shoshana karma is going to take place from the intravascular compartment to alimentary canal, then we are going to say the increase of rukshata in intravascular compartment. So like that, so this is considered to be a relative term. The roga, actually, that is considered to be a relative term. Why identification of the disease, the nidana itself is difficult, or otherwise identifying the disease is difficult now? Because वैलक्षण्य शरीराणाम अस्थायित्वा तथैव च दोषधातुमलानां तु परिमाणं न विद्यते. Because of the specificity or typical situation, the exposure or the variations that are observed in an individual, they are unique, or otherwise asthayitvat, because of instability in different individuals. So that is the reason why identifying a nidana or disease in an individual is difficult. When you think about the total world population nowadays, 8.23 billion is considered to be the world's current population. So that means the exposure of nidana in those individuals and their reactions in the body, they are unique. So that means 8.23 billion ways or something more than that. So that is the reason identifying nidana that will be difficult in an individual. Further, regarding the Vailakshanya, in the sense, the person may be having the Vata Prakriti. If you are looking into the Vata Prakriti, 10 Vata Prakriti individuals, the Vata Prakriti in all those 10 different individuals, the nature will be completely different in all those 10 individuals. That is why the planning the treatment will be very difficult in that particular situation if you are not giving the adequate care or adequate the examination pattern to identify the nature of Vata Prakriti in an individual in such way. Or otherwise, Rasarakta the Sara. So that means the Sara of an individual, so that will be varying in all those individuals. Samhanana, so that is the body compactness of the body, that may differ in each and every individuals depending upon one's capacity to do the work, or depending upon the nature of his or her sedentary lifestyle, etc. Plus, Dirghaswadikaya Bhedena, depending upon the stature also. So, the variations are observed in the individuals. Further, this is about the typical nature of the individuals as such. And the second point here, that is asthaitva, that is instability. In terms of the time, they are of two categories, Nityaka and Avastika. So here the term Nityaka refers to the diurnal variations. So that is, there will be the abnormal increase of kapha dosha in the morning, abnormal increase or the need not be abnormal, normal increase of pitta in the noon time, and afternoon later there will be the increase of vata dosha. Similarly, in terms of the season, in case of the Hemanta Rutu, there will be Kapha dosha accumulation. In case of Grishma Rutu, the Vata dosha Sanchaya accumulation may take place. So, like that. Whereas in terms of Avasthikata, that is the in terms of the stage as such, in case of the childhood, there will be Kapha dosha dominance. And in case of middle age, that will be pitta dosha dominance. In case of the old age, that will be vata dosha dominance. So that is why at a particular time period in an individual, the proportion of the dosha vitiation may depend upon multiple factors, such as the prakriti of the individual, or the sara of an individual, samhananata of an individual's, or otherwise even in terms of the dosha dominance observed at a particular time period. Hence, we have to be very careful while making the diagnosis of the disease in that particular situation. It is being mentioned regarding the how to identify then in that particular situation. It is being mentioned that doshadinam tu asamata anumanena rakshayet aprasannendriyam viksha purusham kushalo bishakam. A skilled clinician will be doing the abnormalcy of the dosha, dusha, etc. by inference. How to do the inference? By looking into the aprasannendriyam, in the sense the aprasanna sharira, aprasanna manas, and aprasanna indriya. That means aprasanna sharira. So that means any kind of the swelling in one particular part of the body, etc. And aprasanna sattva, wherein the person is not in a position to uh, what do you say, that they interact with the surroundings appropriately. Aprasanna indriya. So that may be either jnanendriya or karmendriya. In terms of the karmendriya, unable to lift the hand, specifically for hasta, unable to walk as such, definitely related to pada. Whereas in terms of the jnanendriya, so that is vision, unable to see the objects properly, unable to hear the objects properly, that is shrotrendriyatah. So like that, the aprasanna aprasanna manas, aprasanna sharira, we are going to identify that the person is suffering from the disease as such. Then what might be the possible solution in that particular situation? So here let us take the example. An individual who are having the three clinical presentations on 3 different days. For example, in day 1, that particular individual is having the sneezing. On day 2, he is having cough. And on day 3, he is having the running nose. In that particular situation, what might be the dosha afflicted? We have to identify. So whenever if you think about the first day sneezing, in the sense the organ that is responsible for sneezing, that is nose. So that means the exposure of Nidana is going to take place through Bahya Srotas, that is the nose as such. So here the most probable Nidana in that particular situation may be Rajas or Dhuma, etc. And which particular Abhyantara Srotas afflicted may be, as this particular nose is having a continuation with the Mahasrotas, plus there may be the possible continuation of the same in case with Pranavaha Srotas. The Srotas, Abhyantara Srota afflicted in that particular occasion may be Pranavaha Srotas plus Annavaha Srotas may be afflicted. And is there any possibility of Agni affliction? If the person is having the expectoration of the sputum every time, probably there may not be a possibility of affliction there. But there are certain situations whenever there is the sputum is being produced, these individuals, they are going to swallow it. That's how there may be a possibility of affliction of Agni may also take place. As far as Roga Marga affliction is concerned, we may say that there may be a possibility of Abhyantara Srotas affliction. So, provided if there is any Agni or the Agni dysfunction is being noted. Otherwise, we may say that there may be a possibility of a Bahya Roga affliction, Bahya Roga Marga affliction. And as far as the dosha affliction is concerned, in case of the person who is suffering from sneezing, we may say that there may be a possibility of a Udanamata affliction. Whereas if the person is having the presence of cough, we may say that there may be a possibility of Pranamata affliction as well as Udanamata affliction. Whereas if the person is having the running nose, then we may say that Udanamata affliction plus Kapha dosha vitiation also. To sum up, Rogastha dosha vaishamyam, that means any kind of the abnormal functioning of either dosha or dushya, they are being considered to be roga. Actually, it is a relative term. And identifying the nidana as well as disease may be difficult because of vailakshanya shariranam asthayitva tathaiva cha doshathatu malanam tu parimanam na vidyate, because of atypical nature of the individuals plus instability of the dosha dominance in an individual's at a particular time period. These are the two reasons wherein the abnormal proportion of the dosha dhatu or mala cannot be quantified. In such situation, How to make the abnormal proportions of the dosha? By Anumana Pariksha. So that is the inference as such. Doshadinam tu asamata anumanena lakshet aprasannendriyam viksha purusham kushalo vishak. That's what for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.